Well, I apparently got myself into some hot water yesterday talking about the Canadian health system and how it would impact, how something like it would impact ours. I also made comments about the fact that the Democrats currently wish to have health care basically infused as a part of Medicare and then widen it to a one-payer, unipayer system. It would be a total disaster to do so. It would leave millions with higher costs. It would not allow people, at least according to the Bernie Sanders plan, an opportunity to have their own private health insurance. It would suck everybody into the process, and I don't think it would save any money. So for all those reasons, it's no good. Why am I still skeptical about the process? Well, for multiple reasons. But the second part of it is, and I'll go into this more in a different time, that has to do with the elections and session and Q and the whole idea of preserving our federalism, which I will do in a separate one. I collected the notes from under my Are You Still On Board with Q? And I ended up with 30 pages of notes of various issues to which I'm going to respond, fully recognizing that there's a lot of polarity even among the people that look at my channel from time to time. But let's get back to the health insurance issue. So there are the issue of whether we have a one-payer party system for insurance, as it is envisioned by anybody in the Congress or the Senate, whether they're Democrats or Republicans, are disasters. Why is that? Well, for the same reason that Obamacare is a disaster. And it has, I mean, there are a whole bunch of reasons that Obamacare is a disaster. And as a matter of fact, the person who designed Obamacare knew full well that it was a disaster and knew that the people who might vote for it were idiots and counted on us, them, Congress, being idiots to get it in place, because it was going to be none of what they told us it was going to be. And that has proven to be the case. So the Republicans have come in and said, well, we don't like Obamacare, we want something different. And what happened in this last election, and it is a real problem, is that we looked at what were the top issues on people's minds. According to polling, I know some of you don't like polling, but when you check not to see who wins and loses, but what the issues are, and the top issues are, they were the economy, they were immigration, they were the illegal border crossings, and they were healthcare. And the healthcare variably was first, second, or third in that list. I think President Trump very effectively went after the immigration and border crossing stuff. He substantially was able to say the economy is much better, which oftentimes, most of the time is, as Carville once said in the Clinton administration, it's the economy, stupid, which is true. And most of the time people vote their pocketbooks. So the economy is the number one issue. I think President Trump clearly made it the number two issue as he presented it, with the immigration issue and everything, and border crossings and having a border wall number one. I don't think that we got the full benefit out of the economy, stupid. But the number three issue for the Republicans, and the number one issue for Democrats, and the number one issue for many suburbanites who changed over the last 2 years, and for many white college-educated suburban women who substantially changed in their voting between 2016 and 18, and which is going to be a disastrous problem for President Trump if he doesn't address it by 2020, assuming he's going to run, is this. That healthcare issue has to be responded to, and that has to be with something other than what the Democrats did with immigration and with the economy, which is, we don't like Trump's plan. The Republicans conversely said, we don't like the Democrats' plan. And saying you don't like the Democrats' plan is not an answer. I'm sorry. It's a suck-ass, sick answer. having some proposal to present would have neutralized a lot of the movement of suburbia out from the Republicans in this last election, and President Trump bears some responsibility for that. Yes, they did say, you know, we want to eliminate anybody being removed for pre-existing conditions, and that was helpful, but it's not the same as having an alternative vision. And the Obamacare vision, which the Republicans did not offer to fix, did not fix and did not offer to fix, was that we have in private insurance companies that are making billions and trillions of dollars on health care in this country every year, and nobody has addressed the issue. Why is that? Well, because they're all getting campaign money for it. They're all finding back doors for it. They get to be directors on corporations of insurance companies when they get out of Congress. It's all just a giant scam. Why do I say that that's the case? Well, because last year we spent in the United States $3.3 trillion on healthcare, okay? $3.3 trillion on healthcare out of a total gross national product of $19 trillion. We spent 20%, upwards of 20% of our total gross national product on healthcare. That's not the exact number. I'll give it to you later, perhaps. And we do that largely because Wall Street makes money from it. Wall Street makes money from the insurance people, huge money, from the hospital care and healthcare owners. They make huge money from all of the big pharma, and we are paying huge premiums for big pharma. And none of that has been addressed, and none of it has been properly cared for. Some of you attacked me, and that's fair enough, because I made some comment about having a single payer system, and there were people who said, I'm immediately unsubscribing him because he's a communist, and we're not going to have any kind of public payer system, and Trump and Obama are not going to decide whether I get health care or not. Well, let me tell you how it works now, okay? Because how it works now is not private party payer system like some Republicans would like to have you believe, and that you have free choice and that you have your own insurance company. You get your own doctor, you get your own follow-through, you get your own, the system that you want. Some of that does work. I'm working on a process right now trying to get my family practitioner to talk to a specialist who has to talk to another specialist who will then tell me whether or not they will deign to serve me about a healthcare issue. And I cannot jump the system, and I cannot shortchange the system. I cannot go to the specialist. Not only do I have to be referred by my family practitioner, but the family practitioner has to send me to a general specialist who has to send me to a special specialist, and at each layer they decide whether or not they want to take me, even though I have Medicare and supplemental insurance and I'm fully insured, and there's no way to hop the system at all. And it's a total disaster. And none of them care about my health care or whether or not things are going good or bad for me. It is whether or not I've frog marched, which being the frog, I got to pay for, right? Whether I've frogged through the system to get to it. So some of the people in Canada took issue with my comparing the potential downside of having a single payer Medicare system to their system. And their system clearly works better, there's no question about it, than Medicare modified would work for us. And many of the Canadians said, I got really good health care. I didn't have to wait. The queuing was not long. In emergency stuff, it worked really well for me. And I think that's the case. It probably works for most of the people most of the time. For non-triage, that is non-emergency kinds of things, the common complaint in Canada is that you wait 1 to 3 years to get through the queue because you're not needed. It's not an immediate need, and you don't have as many alternatives and as much avant-garde medical care as is available in the United States. So some people in the United States, some people in Canada come to the United States, and we hear from them. So let's take a look at the other issues having to do with how it fits into the total system. And I can tell you that here's the reason why. There are several reasons I looked at the unipayer system, one of which is that we need to fix our healthcare system. And why do I say that? Well, let me compare, okay? First of all, we spend nearly 20% of our federal gross, not our budget, not our federal government budget, our gross national product. That is, $2 of every $10 that you make on average goes toward healthcare. The average person, the average in the United States per capita healthcare requirement today is $10,348 spread out across the country. When you get $3.3 trillion, you end up with $10,000 a person for health care, and 5% of our citizens in the United States spend half of that. The rest of us spend, the healthy half of us spend 3% of that, almost nothing. So do we have a uniform kind of healthcare system? Not uniform, but we in effect are subsidizing it. Tell me, you say you don't want to have a single payer system, but in effect, healthcare insurance is a charging the people according to what they can afford and paying for people according to their need. Tell me that's not socialized medicine. It is privately funded, so privately managed, privately overseen, privately maintained, socialized system in effect. Now you say, well, I don't want to have socialized medicine. And I say to you, well, you already do. And you have had for most of 80 years. And it is certainly the case now. So are the people who are uninsured not getting health care? No, that's not true. They can go to the emergency room. They can get coverage. And do they pay for it? The answer is no. Who pays for it? Well, the hospitals have to balance that in. If there are 10% of the people that don't pay at all, the other 90% of the people pay, including those covered by insurance and not covered by insurance, pay 11% more, right? And so we all, in effect, already subsidize the uninsured. So how is it that we are privately covered? Well, we're not privately covered. Let's go through this. The Veterans Administration covers 9 million veterans, okay? 9 million veterans. They're already covered in the system. We have 2 million active federal employees and 7 million contracted federal employees. That is, private employed people in Boeing, McDonnell Douglas, and 100 others that are working on federal contracts that are all covered by insurance. And they're all covered, and we pay for it, folks, because we pay for all those budgets. We have 6.2 million state employees, and those state employees are all covered, and you and I pay for that. We have 13 million city employees, and we all pay with our taxes. We all pay for those people to have health insurance. You think, well, all right, the rest of us are on private care, right? No, that's not the case. You're wrong. Medicaid covers 19% of all people in this country, 19%. So we're talking about 60 million people, in effect, in some fashion, covered by Medicaid. Is that it? No, that's not it either. There's Medicare, and Medicare covers 14%. So what is that? 45 million of us are covered by Medicare. It's still subsidized, socialized, multi-party, population-paid insurance. And you say, well, all right, the rest of us are all private. No, that's not true either. And why do I say that? You say, well, because I'm paying for my own insurance, or my company's paying for my own insurance. Therefore, I'm not part of the system. And I say to you, that's not true. Why do I say that? Well, because the corporations deduct the health care that they provide to you, and they take a tax deduction for it. So guess what? If your employer pays your health care insurance, we're paying for it. We help pay for it. If you are a private payer paying for your insurance, does it show up on your tax return? Yes, it does. Now, if you take the standard deduction, it's covered within it, but in effect, that standard deduction is there to help subsidize you for paying for normal health care. And if you have extraordinary expenses, you get to deduct that from your taxes and therefore pay less. So are the rest of us paying for it? Yes, we are. So how much of this is covered? Well, in effect, 91% of the people, through employers, through veterans, through public health care, through Medicare, through Medicaid, as veterans benefits in retirement, are covered, 91% of us, and we're paying for the other 9%. So it's all included. If you think you don't have subsidized medicine and that others are not receiving subsidized medicine protection at this time, you're wrong. So how do we compare with other major countries? Well, let me compare to Canada, since I'm the one that was critical of the Canadians. Mea culpa, mea culpa. So let's go back here. Let's see how they do. Well, we spend $10,348 in 2016 for each man, woman, and child in this country. Canada spends $4,700, less than half as much as we do. Switzerland, which is the next closest one, only spends 80% as much, less than 80% of what we spend, $7,900. Germany, you think, well, Germany is a big socialized medicine, socialized country, welfare and all the rest of this stuff. They've got all of these immigrants. They spend $5,500, almost exactly half of what we spend. Sweden, socialized nation, socialized medicine, socialized everything, high cost for lots of stuff, lots of government, spends $5,400. Netherlands, another socialized high employment country, spends $5,300. So what about Australia? $4,700. France, $4,600. Japan, $4,500. The United Kingdom, the British, some people complain about British healthcare, but they spend 40% as much as we do, $4,000 per capita. So we're spending more than anybody else and twice as much as anybody except Switzerland. So how does it compare to the uniparty system, the single payer system in Singapore? All right, well, I made a comment about it. Singapore attempted to set their healthcare system up after they looked at everybody else's, and they looked at what worked and what didn't. Now, they have a small population, and they have a much more uniform population than, for instance, we do. But they had a lot more control over it. So they spend, out of their $508 billion gross national product, they spend $9.8 billion on healthcare. That is 1.9%. We spend somewhere between 18 and 20%. They spend a tenth as much of their gross national product on healthcare as we do. And they spend only about 2/3 as much per capita based upon that per individual per capita income in Singapore. You say, well, obviously they have lower cost of living, so they spend less. Well, no, they spend less per capita, and they spend 2/3 as much per individual income. So they only spend about 12% of their per capita income, and we spend 17.5% of our per capita income. So for all of these reasons, we have a spoiled, rotten, defunct, overcharging, corporately managed healthcare system, which is siphoning off roughly half of the $3.3 trillion for corporate profits. What else is wrong with it? Well, we have Rothschild Rockefeller-based healthcare teaching hospitals where medical doctors are taught, and they're on the boards of most of those. And our healthcare and system is almost entirely cut it or pill it, right? Everything is either cut it out or pill it, or well, we can radiate it, or we can chemo it. We can take some drugs that we've prepared and pour them into our system and nearly kill ourselves off. Do your doctors ask you about your diet, your exercise, your mix of health care, your supplements, your vitamins? No, they don't ask about those things. They say, well, gee, you've got something wrong with you, here's some pills. You've got something wrong with you, we're going to have to do surgery. That's basically it. We don't have preventative medicine, number one. Number two, our healthcare people are all trained by the oil company Rothschilds and Rockefellers, and so all of the natural healthcare over the last 100 years has disappeared from our systems, and the naturopaths and alternate healthcare doctors have been killed off. 300 of them have died in the last year or two speaking out. Maybe they'll come after me too, because I am at least promoting it. What the hell, you know? All right, but beyond that, we have healthcare systems that don't look at physical therapy. We don't look at psychological stuff. We don't properly care for other stuff. We don't do regular maintenance. We don't do preventative care. We don't do annual checkups. All of that stuff is defunct. And let me tell you another thing, and the Canadians, a bunch of them pointed this out, and they said, you know, we don't have these boutique, fancy, high-priced, high-paid doctors here that are charging huge sums. And you know, they're right. For the most part, they're right. What's our problem? Well, you capitalists, listen, because I have a capitalist message for you. We supposedly look at, and we know this works, if you have more doctors, they each charge less. Why is that? Because they have to compete for the market, the pool, the people that need help. If you have so many, let's say, orthopedic surgeons, right? And you have more orthopedic surgeons per capita than you did 10 years ago, those orthopedic surgeons are going to get less of a premium. They're going to have to lower their prices. They're going to be more competitive, and they're not going to make as much money. So what am I getting to? Well, the fact is that we are training only about as many doctors as we did 20 years ago. And our medical doctor training systems, our colleges, our universities for medical doctors, have been log jammed and stopped from growing for 20 years. Why is that? Well, because the AMA knows that if they keep those numbers down, we all get charged more. And so many of the problems are, number one, we're paying way too much. Number two, it's harder and harder to get in. Number three, they exclude anybody that they really don't want to work on. Number four, it takes all kinds of referrals and the rest of that. And those high-paying, high-charge ones, like, for instance, a urologist or a neurosurgeon, the rest of these things, deserve to be paid a lot of money. Should they be making $900,000 a year or $1.5 million a year? I know of a doctor, I can't remember. Oh, I know, he was an anesthesiologist, was in Montana. And he got offered $700,000 or $800,000 a year, this is 10 years ago, to go to Houston. That guy is not available for anybody in Montana. And the reason for it is that there are not enough anesthesiologists. So my point is this: if we're going to lower the cost of health care, we need to double the size of our medical facilities, and we need to do it now. We need to have a 2 to 5 year plan. Why is that cost effective for us as taxpayers? Well, I'll tell you why it's cost effective. Because a couple $2 billion paid out to double the size of teaching hospitals and medical schools would pay in terms of cutting maybe a third of the $600 billion a year we spend for doctors. That would cut, it would cost the cost by $200 billion. I'm using wild hypothecated numbers, But it is absolutely positively the case that if we had more doctors, more nurses, more physical therapists, more healthcare people, if we subsidized the process of them learning to get into the field, we would reduce the cost and we would take a lot of the stress off the system. So there are lots of things that we can do, but we may well be best off. And I know some of you free market people are going to say, well, this guy's a communist. But healthcare, whether you like it or not, is being treated as a fundamental right. It's not in the Constitution, but it's being treated as a fundamental right. And why do I say that? Because if you go to an emergency room, many of these, some of them just some hospitals closed their emergency rooms altogether because they knew that they were subsidizing people that were uninsured. But if you go to an emergency room, they are going to take you. They're not going to turn you away. I go to the emergency care stuff here in Arizona, and I know that 10 or 20 or 50% of the people there are not even citizens, and we're going to pay for it. So we're paying for huge costs and expenses to people that are not contributing to the system, and that is part of our healthcare system, and it would be vastly cheaper not to be treating them in the emergency rooms, among many other things. So I hope this has been in some sense helpful. We need to cut our costs, and the Republicans need to come in and say, hey, look, we have a better plan that costs half as much money, and we're going to address the issues of horrible overcharges for pharmacy, for the impossibility of us getting pills, etc., from foreign countries like Canada, where they pay a third as much, and Mexico, where they pay a fifth as much for their medicines. So we're protecting Big Pharma. And if you look at who is paying for these people running for office, you'll find Big Pharma, Big Oil and Gas, the AMA, and the rest of them right in the middle of it. The insurance companies right in the middle of it. And those guys are all beholden to them. So is the corruption all gone now after the election? Horse potatoes, man. That is not the case. All right, so that's my healthcare discussion. I will have comments about these other things. I'm going to wait until 9/11 is over, or until late in the day, to see what kind of huge Q drops are coming on the 100th anniversary of the armistice. That will be interesting. I'm sure that there are going to be major happenings in the next 48 hours, right? Thanks for watching. Thanks for supporting. Thanks for being open-minded about this. We don't have to agree. I'm here to bring one position, one point of view, one perspective, and there are very wise people you see in the comments that don't agree with me. It's quite all right. It's not a problem. So thank you so much for watching. Give a thumbs up if you can, if you will. Subscribe if you can or will. Hit the bell, and maybe somebody will let you know when I'm on, and we'll go from there. Thanks again.